Well, efforts continue to fight the spread of Ebola in the Democratic Republic of Congo, where the virus has infected more than 1,400 people and killed over 430, according to officials. The Danish Refugee Council, though, says that this crisis facing the DRC isn't just a health emergency, with violence, coercion, and insecurity structurally embedded in daily civilian life. A recent report says the humanitarian system in places like Ituri province, where the outbreak has been especially severe, is already stretched to its limits, and therefore the Ebola response must not hollow out the aid programming that's holding communities together. Well, to talk more about this, I'm joined by Charlotte Slente, who's the Secretary General of the Danish Refugee Council. Thank you very much for being with us on France 24.
Thank you very, very much for having me here this morning.
When you describe the situation in the DRC, you use the term protection crisis. Can you tell us a little bit about what that means?
Yes, what we see now is that this strain of the Ebola virus is basically spreading in an area that is very much already affected by crisis and conflict for many, many years. It's an area where people live in high levels of insecurity, in high levels of fear. Many, many people have been forced away from their homes. They are now living as what we call internally displaced in Ituri, in the province of Ituri and broader Eastern Congo. In Eastern Congo, more than 5 million people have already been displaced. And in the Ituri province, sort of the epicenter of this Ebola crisis, more than 1 million people have been displaced. And they now live in extremely dense areas of displacement sites, basically without normal housing conditions. They live under plastic coverage, under extremely fear and strain. Because what we see in these camps or sites is that the armed groups actually infiltrate these areas, creating fear among the population and creating a situation where women and girls are exposed to sexual violence, where groups of young boys and men are forced by the armed groups to become members of the armed groups. So already an area of severe fear and strain on the population, with very limited access already to livelihoods and to water, sanitation, jobs, income, etc. So this is the environment that this virus is now spreading in.
And you mentioned, of course, armed conflict, that kind of coercion by those gangs, by the militants. Can you tell us a little bit more about the kinds of things that your contacts are experiencing on the ground? Have you received any testimonies that stand out particularly to you?
I mean, we have obviously numerous stories, but the concerns here is that if you basically close down the refugee or the displacement sites and you quarantine these sites, you're basically locking people up in contained environments where then the virus can spread in an uncontrolled manner. And as you said, we have already seen very, very high numbers of infected people and death due to this virus. So that if people are confined within the camps, the virus there can basically spread, and people need access to their livelihoods, access to food, access to water for their mere survival. And if people are held back from these possibilities, they will find unsafe routes to seek access to food and water, areas and routes where medical staff might not be able to come, where medical staff cannot monitor the situation. And that means basically that the virus goes undercover and therefore can spread massively. We obviously hear stories that there's the story of the body of a young girl deceased due to the Ebola outbreak and the virus, who was brought back into one of the camps in Ituri, accompanied and supported by 8 people who touched her dead body, and thereby bringing sort of the contamination into the camp, but also contaminating the risk of contamination of the people who who brought the body of the dead girl back to her parents inside this site. But it's very, very important here that the restrictions or the protocols by WHO are abided by, so that we don't quarantine displacement sites, that there needs to be open entry and access so that people can move in and out without being confined to a very closed area where people live in overcrowded spaces.
So obviously there are already kind of humanitarian and aid programs in place there to help people, notably those who are displaced. Is the Ebola response in any way undermining that, or vice versa?
What we are seeing is basically a funding crisis of humanitarian assistance already before the outbreak of Ebola. I mean, levels of support to Eastern Congo have gone down remarkably since last year due to the funding crisis in the humanitarian response. So I think we were at levels of $1.4 billion of response in 24. Last year, we were down to $400 million. So already a very, very difficult environment to secure access to livelihoods, safety, schooling, protection for people. So now with the virus coming here, there's a risk that these resources are now turned into a response to Ebola. So instead of protecting people, it's used for quarantine spaces for the medical response. And that basically drives a lot of mistrust among the population, because it means that resources are driven away from sort of the basis of livelihoods and survival of people into treating this medical disease. So one of our key messages here is that you cannot sort of isolate that response. You need to work on all tracks in parallel. You need to ensure that people have access to livelihoods, that children and women have access to protection, that young boys are not being recruited into armed groups, at the same time as you treat the medical emergency situation on the ground. And that means that we need more resources on the ground now to be able not to have to prioritize among very key ingredients in actually making people safe.
But how do you achieve that? Is it just a matter of funding, or is it, people on the ground? Is it just pure attention and awareness of the international community?
It's funding primarily, and then it's obviously DRC works in this environment. We work close to the front lines of this conflict and also work on this health emergency. We are recognized by the health authorities in DR Congo to do so. What we do is basically apply the protocols, the medical protocols, to the protection programming that we do. So, for instance, we now work to provide cash assistance to people who can no longer move due to the disease and seek access to their normal livelihoods. So that kind of, mobile money cash assistance over a longer period of time. We provide support for water and sanitation and hygiene components in our programs. One of the very important things is to ensure that schools are kept open to avoid that children suffer sort of the secondary effects of this crisis, which is being forced into forced labor, into violent situations, into recruitment into armed groups. So schools are a safe place where you can also then do preventive mechanisms, distribute hygiene kits and hand washing kits to children, and educate teachers on prevention issues. So all of these kind of measures need to be taken, but understanding that you work in an environment where you cannot sidetrack the basic protection activities that you are doing just to allocate resources to the medical response. They need to go hand in hand. Also for the local population to actually buy into this response. Because if you channel basic resources used for water, sanitation, food, and other services into medical isolation tents, people will basically not cooperate with you because there's a very basic mistrust in the population because people have been neglected for so many years by the authorities in so many ways. No one has been able to stop the violence and impede the effects on the civilian population of that violence that has been there for so many years. So if you want sort of acceptance and cooperation by the local population, you need to attend to the basic needs, to the protection of civilians, at the same time as you respond to the medical emergency situation.
Because have you seen that mistrust among parts of the population worsen recently with this outbreak?
Yes, basically we have seen that there's a lack among some of the communities, displaced communities, to cooperate with the medical response. And we've also seen burn down of medical evacuation tents. And basically people are reacting to that lack of trust in authorities and being very cynical about why is it so that suddenly authorities make themselves available and present in camps and among populations where we haven't seen any support now for decades. So there is a sort of a natural mistrust and distrust that you have to work with in such an emergency situation.
All right, Charlotte Slente, Secretary General of the Danish Refugee Council, thank you very much for coming in and talking to us about that very important issue.
Thank you.